So today we're going to do a Bimini Medical microneedling demonstration just to show you how to optimize our system. So we have successfully anesthetized her skin and we are going to do a little test patch now. I rub off the anesthetic just before I do the needling. And now obviously to switch our unit on, we just give it a quick pressure and we adjust the needle depth. When we do a test patch, I like to start with 0.75 and oscillation speed on 3. To adjust the oscillation speed, you obviously just hold in the button slightly to be able to get the oscillation higher. So Annie, this is just a little test patch to see if the area is numb. How's that feeling?
That's perfect, thank you, Carla.
Okay, so as you can see, you need to support the skin properly to be able to assist in the needling process. I'm going to adjust the needle depth now. As Andy has mentioned, this is absolutely fine, and she also now knows what it feels like. So we are going to, I like to work with just over 1, but below 1.5. This is Andy's first needling session, so we want to make sure that she feels comfortable, and also up the oscillation speed to number 5. Okay, so with nice pressure here, we basically start going. If you have saggy skin, you need to understand that supporting the skin will allow the needling device to glide over the skin. You also need to keep in mind that the anatomy of a skin or of a patient is different. Thus, you need to follow the contours to allow successful needling. Okay, so we're moving up and down. Then you can move sideways. You can see where there's less support because the skin wobbles there more. So really try and support the skin properly. What we're aiming here, or aiming to have, is blood spotting, which is occurring right now. As you can see, you leave the skin for a couple of seconds and the blood is actually coming to the surface. Once we've achieved blood spotting on the skin, we can move over to a different area. Okay, so I believe this area is good for today. Again, I like to use wet gauze. You can really use dry gauze as well, should you prefer. Just to show you a difficult area, it's close to the eye bone here. Again, my settings stay the same. I adjust my support. You can go right into the hairline. Again, I'm following the bony structure of this patient's face. I will adjust my needle direction and speed and depth closer to the eye area. This is a lot of the time where we treat crow's feet, so try and really get nice blood spotting here. Again, today is just a demonstration, so we won't be administering needling over the whole face, just in some areas where you might find the device tricky to use. How are you doing?
Good, thank you.
Alright, so now, as you can see, I'm still keeping my settings the same, because over here is often where we want to treat our lines. Notice the support that we're giving and following this bone in this direction. I use the anesthetic as a glide. You can use hyaluronic acid serum, collagen serum, any hydrating or serum that you normally use, you can use to facilitate extra glide. However, we all know that needling itself does not depend on the product being used, but by the process. Okay, so next I want to show you how to needle nice and close to the eyes. First, we adjust our needling setting to a little bit lower. Let's just do 0.5 for starters. And then I go a little bit. Let's do 4. 1, 2, 3, 4. Make sure that the surface of the head is completely onto the skin. And you might feel a little bit of a sharp sting every now and again. Notice the support of the area, allowing the needle to glide perfectly.
Voel.
Squeeze ons is nou klaar.
Zo.
Sorry. There we go. We're not going to torture Anne anymore. But you can see you can really go, you can actually go a little bit closer than that. But that is good for today. Just to show you how to basically use that around the eyes. Now we're going to move up to the brow area. Whilst it's on the same setting, again we remove the anesthetic. Here I like to take a dry gauze because it allows for better support. Again, I'm pulling this eyebrow so that it's on this bony area. First I go this direction. And then I do straight. And again, we can go lower than that, making sure that your support is properly. Try and keep the head of the needle onto the skin. There we go. And we are completed with that area. Next, we're going to go onto the forehead. Again, we remove the anesthetic. Now I'm just adjusting the needle slightly higher. Remember, the bony area on the forehead is difficult to needle and is often more uncomfortable for your patient. Reason being, there's less fatty deposits underneath this area. You also need to keep in mind that the anatomy of the forehead is different. So you'll need to follow the bony structures. I'm just lifting that up as well. I do small areas on the forehead. It just gives me more control. And he's got some pigmentation over here, so we want to try and focus our attention on that. Good. And my next patch. Whilst you're needling like this, you can overlap. You don't want to overlap once you've left an area for a couple of minutes, because then the patient will feel it. You can see there's lovely blood spotting underneath that skin. So you can see it will start to hook there because I'm not really supporting it. I'm supporting this area. So when you're finding that the pen is giving you some hooking, then you need to obviously assist by supporting the skin properly. can go over the eyebrow area as well. Often ladies with permanent makeup wouldn't want you to take it away, so just check. Trust me, you're not going to leave areas unneedled. You are overlapping quite a bit. So you can see, I mean, there's a bone right here. So you can't just go and needle like that. You need to support properly and follow the contour of that area. Now there's a nice line over here as well. So we like to highlight that. So we basically just run the needle across there quite a few times. Again, you can move left and right, up and down, whatever works for you. But the key is obviously using proper support and needling the forehead in basically smaller areas. Alright, so we're basically going to just finish off here. We have a small area to do. And then we're going to take a break. And we'll get back with some more needling tips. Again, as I said, make sure that the bottom of the needle, this area here, is basically going to be flush against the skin. Good. I'm going to be putting some cream on this area that's been needled, and then we are basically going to carry on with around the mouth, on the nose, and I believe the chin, because I think the chin often tends to be difficult here, especially if there's lots of pores and bad skin texture. Alright, so we're going to be just taking a short break.